Dr. Golden, it is a privilege to welcome you as a guest for the e-newsletter Homoeopathic Pulse. You are arguably Australia's most experienced homeopathic practitioner, teacher, and author. From being the author...
I think that's a little bit exaggerated. In homeoprophylaxis, maybe, but there are some wonderful homeopaths in Australia as practitioners who have been doing it for many, many years, who are wonderful teachers as well. I certainly, in terms of homeopathic immunisation, don't mind putting my hand up for that, but not in general.
I guess you're just being generous, humble. But from author of 11 books and numerous articles on homeopathy to conducting mammoth research studies, laying the foundation of the Australasian College of Homeopathic, Hahnemannian Homeopathy, yours is an impressive body of work spanning almost 3 decades.
Well, it is 3 decades now. Yes, it's past the almost.
Oh, yes. So, homeoprophylaxis is a subject which is at the very core of your work. You're widely known as an authority on homeoprophylaxis. Tell us how your journey with homeoprophylaxis began.
Well, I first started off life professionally as an economist, as someone who taught financial accounting theory, and I actually ran a taxation practice in Canberra, Queanbeyan for 3 years. And I hadn't studied homeopathy, I'd never heard of it. And back in those days, I used to vaccinate my own children, and one of my children was vaccine damaged. And that then forced me, in a way, on a journey to start looking at vaccination. Some years, a couple of years after that, when I decided to change my career path, I came across homeopathy and fell in love with it immediately. And when I started studying Hahnemann's writings, to my amazement, I found, because I'd not seen anything about it in the studies that I'd been given by the colleges that I studied with, I saw that Hahnemann had used homeopathy to immunise people against infectious diseases. And so I guess that was the moment that my dharma was set within homeopathy. And I relatively quickly gathered whatever articles I could in English. There were very few. This is back in 1984-85. There were very few that were available. In fact, the most valuable little booklet I found was by P. Sankaran. And I think it was just homeopathic immunisation or prophylaxis in homeopathy, something like that. It's a very small little booklet, but what he did was summarise a lot of journals, references and use of homeoprophylaxis in different journals over the years of homeopathy. So I got some more references from that, and then I put together an alternative for Australian carers to the orthodox vaccination schedule. So I did that first in 1985, and along with the instructions with that program, it was a 5-year program, there was a questionnaire at the end where I asked parents, after they'd been using the program for over a year at least, to get back to me with their experiences with their child. And I started collecting the data from those responses in 1986, and that culminated in 2004 when I did finished a doctorate at Swinburne University, and was basically looking, primarily, there were actually 2 parts to the doctorate, but primarily at the data from 1986 to 2004. And I think it is the world's largest long-term study. It certainly is not the world's largest study. And my first experience with massive interventions was when I was invited in 2008 to speak in Cuba at a conference organised by the Finlay Institute, which is a research institute and the place where they manufacture vaccines. In other words, the Finlay Institute in Cuba is in charge of infectious disease management. And it's very practical, it's not theoretical. Whenever there's an outbreak of something there, the folks from Finlay are the ones who go out to the provinces and deal with the outbreak. If they need to make immunisations, they will use either vaccines or homeoprophylaxis. They're using both still at the moment. But I've been there now 4 times back to Cuba, working with Dr. Braccio at the Finlay Institute and the president of Finlay, Dr. Kampa. They're both wonderful people whose lives are really devoted to helping others. And they've done some wonderful work. In fact, as I said, I was there just a few months ago. That was my 4th visit. And we've come back with a lot of data. And Dr. Braccio and I hope to publish a lot of the new data, apart from the leptospirosis data, which a lot of people are familiar with. But there's a lot of new data available as well, which we hope to publish next year. So really, my journey started with an unfortunate experience with vaccination, which then led me to look further. And as I said, when I experienced homeopathy and found that Hahnemann in 1798 used belladonna as prophylaxis against scarlet fever, that's when the game changed for me.
So, as you just mentioned, you have conducted what could be the world's longest long-term trial of homeoprophylaxis, of almost 20 years. What were the key findings of the study with respect especially to the effectiveness and as well as to the safety of homeoprophylaxis?
Safety is an interesting question because in theory homeopathy should always be safe. But as we know in practice, when we're treating people, you can overprescribe. And so this was a very important issue for me when I did my doctorate. And the second part of the doctorate was totally aimed at looking at long-term safety, because a number of my colleagues in Australia had said to me, okay, you're using high potencies, you may only be giving the same remedy once a year, but you are through you're giving other remedies in high potencies. How do you know this is not having some negative impact long-term on the people who are using it, the children mainly who are using the program? So the second part of my studies at Swinburne University were what I call the General Health Survey, which involved looking at 4 groups of people. There were fully vaccinated, fully homeoprophylaxis, people who used constitutional prevention methods instead of disease-specific, and people who did nothing at all. And then I looked at 5 long-term health conditions. And this was in children aged between 4 and 12 years of age. So I looked at asthma, eczema, ear and hearing problems, allergies and behavioural issues. So that gave me a matrix of 20 cells. And the aim was to see if there was any evidence at all that the use of homeoprophylaxis long-term caused a weakening in the general health of the people using it, as measured by an increase in the incidence of those diseases. Now, the findings were very, very interesting. As we probably could have predicted, the children who were vaccinated were considerably less healthy than the other 3 groups. For example, with asthma, it showed that children who were vaccinated had 14 times greater chance of having asthma than children who used homeoprophylaxis, and about 6 times greater chance of getting asthma than children who did nothing at all. And it wasn't as extreme as that with the other diseases, but the vaccinated kids were definitely clearly worse off, and these were chi-squared probability tested, and most of the findings were greater than 95% confidence. Now, the most interesting finding, though, because I kind of expected that one, the most interesting finding was when I compared children who used homeoprophylaxis with children who used constitutional prevention, because I expected the constitutional group to be healthier in terms of a lower incidence of long-term diseases than the HP group, and they weren't. In fact, you could probably say the HP group is marginally more healthy. So that threw open the question of why, and the answer is in the organon, as homeopathically most answers are. And it's when Hahnemann talked about the advantages of people doing provings, Now, he, of course, was not giving monthly doses of different remedies to people, but still, the fact that an individual remedy is only given annually, or less than that, in my program, showed that the chances of proving the actual remedy is minimal. But the process of doing the proving is still challenging on a more subtle level than the physical substance, of course, but it still is challenging the immune system. And so my understanding of the results, the practical results from the General Health Survey, was that a properly organised homeoprophylaxis program, even if it's long-term, as opposed to just in epidemic conditions, if it's done correctly, will actually have a stimulatory effect on the immune system. And just as we know that it can be very beneficial for people to get simple infectious diseases, it can help to mature and activate the immune system. Homeoprophylaxis seems to do that as well. So that's safety. Now, in terms of effectiveness, because really that's the most important question, we know homeoprophylaxis, just as homeopathic treatment, is not toxic, but there's no point using something which is safe if it doesn't work. So the measure of effectiveness is very important. Now, when you look at the relatively few studies on short-term homeoprophylaxis use, they tend to come in around the 90% mark. And what I found from my, as you said before, 20-year data collection, was that the long-term measure of effectiveness came in around that figure as well. So my single-figure measure was 90.4%, and the 95% confidence limits were about, I think, 87.3 to 93.4, something like that, but very close around the 90.4, which of course helps to give additional confidence. Now, my study is just one study, so you need to look at it in the context of all of the other studies that are out there as well, but it has an importance. And the other reason I should mention that I did this through Swinburne was so that my data could be looked at by people with orthodox medical training. So one of my supervisors was a professor of medicine, the other one was a medical epidemiologist. And they was very, very helpful. And as a result of that, their guidance and my other work there, we applied 7 tests to the data. I won't go over them all now, but it's all written down in my books if people are interested, to try and make the data as strong as possible. So even though it was not a perfect test, it relied on memory of parents, for example, but we went back and we tested the memory. We tested the answers that were given by the parents. So it's as rigorous as it possibly could be. It was a prospective cohort study, long-term, longitudinal, and we did as many tests as we could to make the data as strong as possible.
I see. So, Dr. Issac, you also specialize in the treatment of vaccine-damaged children. Tell us more about your methodology and experience with the homeopathic intervention in the treatment of vaccine-damaged children and associated conditions such as ADHD and autism.
So this has come about, I guess, because of my work with homeoprophylaxis. People have sometimes vaccinated their children with one or more vaccines and then decided to change. And then, some of those parents have had children who were clearly affected by one of the vaccines, as one of mine was, and they've come and they've asked for help in dealing with the consequences. Now, some years ago, I published a book simply titled Vaccine Damaged Children, Treatment, Preventions, Reasons, a small book, that it gave some case histories, and what it did, it also showed the data that I'd collected over a number of years from people who were using potencies of vaccines, because very often I base the treatment around a potency of the vaccine that appears to be the culprit. And when I say appears to be, that comes from careful case taking. So when a child comes in, whatever the parents say, one has to start with the basic homeopathic case taking, particularly looking at points of change. And I find this is enormously important. If you can find the never well since parts in a case, I think you're halfway there to solving it, whether it's vaccine damage or not. And time and again I would see parents saying, my child was developing perfectly up to 12 months of age, they were starting to say words, their eye contact was good, they were affectionate, and then within a few weeks of the vaccine, the words stopped, the eye contact stopped, and they no longer were affectionate to the two parents and the siblings. So when you see a case history like that, you really don't need to investigate a lot more. You know what the trigger is. So you identify which vaccine it is. Usually it's the MMR, but not always. And then I would generally start with giving potencies of the vaccines, and then, depending on the results, depending on what symptom changes occurred, I would then go up the potency or bring in other remedies. So I don't have a rigid protocol. I don't always start with the lowest potency, and I certainly don't always start with the highest. It depends on the patient, just as it should, in general homeopathic prescribing. Everything should depend on the patient. We need to address the patient's needs.
So does that mean that you actually potentize the vaccines as such to work?
Yes, to use as a remedy. Yeah, well, I don't personally. Usually I don't. I mean, I get the remedies from licensed homeopathic laboratories.
You have been involved in a very large homeopathic intervention effort against leptospirosis in Cuba. So tell us more about that.
Well, I was not directly involved initially. That was done by the folks at Finlay Institute in 2007 and again in 2008. And as I said, I first went to Cuba in 2008, December 2008. So both of the leptospirosis interventions were done prior to me arriving there. But what I found, to my surprise and delight, I've got to say, was that it actually used my protocols in the intervention. So Dr. Chawla had found out about my work that I published, and he drew on that. And this is one reason they invited me to speak at the conference. But I quickly found that I was there to learn from them, not to teach them. And it's been a great pleasure. It's been a wonderful part of my life, forming friendships there as well as professional associations, because the work they're doing with homeopathy there is quite amazing. But basically what happened, they have a vaccine for leptospirosis in Cuba, which the Cubans developed at Finlay. It's about 75-80% effectiveness, I think, something like that. But in 2007, they had a very bad hurricane, and particularly in the east of the country, the cases and some deaths spiked. They grew very sharply. The vaccine, as was used then, was not holding the outbreak. So they decided to use homeoprophylaxis, and within 2 weeks, they'd covered the entire population of the 3 worst hit provinces in the east of the country, Granma, Las Tunas and Holguin. 2.2 million people they'd immunised with 2 doses, about a week, 10 days apart, of the leptospirosis complex that they'd used, 200C potency. In 2008, they had 3 bad hurricanes. It was a very bad year. And they used a 10M potency. And they're the 2 potencies I tend to use in my prophylaxis protocol, 200 and 10M. So basically, they, and I should say they also published some findings from the 2007 intervention in Homeopathy magazine, journal. But when I went there in 2008, the actual results from the 2008 intervention were even more impressive than the results from the 2007 intervention. So Dr. Chawla and I have published a number of articles now, and it's in the latest editions of my 2 main books on homeoprophylaxis, where we've looked at the 2007 and the 2008. So I've certainly worked with him very closely on the data analysis that they did the actual
If we
interventions.
look at the historical background of homeopathic prophylaxis, we see that it was first described by Dr. Hahnemann in the article Cure and Prevention of Scarlet Fever. Then in Brazil, a study with meningococcal meningitis showed promising results. Having said that, homeopathic prophylaxis has been largely an area lacking standard protocol. What, according to you, is the best practice model in homeoprophylaxis?
Well, based on not just the Cuban experience, we need to look at all the experiences. And even though there haven't been a lot of studies, we have had 200 years of clinical use, and there's a huge amount of information there, which is of great value, even though it may not be quantified. So, I would break the answer to your question up into two parts. Firstly, long-term prevention, and secondly, short-term prevention. So for long-term prevention, I generally start with a single dose of a 200C potency, followed a month later, provided that the child, when we generally talk about children here, or the adult, if it's used in adults, did not aggravate in any way, followed a month later by a triple dose of the 200, and then about a year later, I give a triple dose of the 10M potency and give a couple of more doses, say, in the next 3 to 4 years. Now, I would believe that that would cover the person for at least 10 years, but I always say in my long-term programs that if a person is exposed to a high risk of exposure from a particular disease, you should always use a booster. Because we know when we study failures with both vaccination and homeoprophylaxis, they are most likely to occur when the person is constantly exposed. For example, parents bringing whooping cough back into the family home without knowing they've got it, because in adults, healthy adults, it's a mild disease, but they're exposing their child every day. So that's the general protocol for long-term. With short-term prevention, I think there's a lot more flexibility. Now, the Cubans use 210M for their leptospirosis, and I don't have a problem with that at all, but certainly I do know that if you only had, say, a 30C, you can use that. You just give the dose more frequently. Now, I do also a lot of prophylaxis for overseas travel. Now, some of the diseases we in Australia regard as overseas travel diseases are probably common for you in India, and maybe vice versa, I don't know. But basically, I get the person to identify what diseases that they're likely to be exposed to. I try and get them to start 1 month before they're going to be exposed, and generally I give a potency of either a 200 or an M once a fortnight. So they start a month before they leave, so they get 2 doses of the remedy before they hit the danger area, and then they keep taking it whilst they're away. Now that's the short-term travel, 4 weeks, 2 to 4 weeks, something like that. If a person's going into an area for years, then it moves across to the long-term prevention, and that's when I'd use the higher potency. But all the while, remembering that we need to be flexible, and say is travelling in the malaria area. If they move from one part of their journey to a new part where the exposure to malaria is very high, they might be wise to take a remedy weekly for a couple of doses whilst they're there, and then, of course, once they move out of the danger area, they can stop taking the remedy. They're the general protocols I use.
Emerged as a global hub of homeopathy, and I understand you're also planning a visit to India very soon. So, what is the agenda of the visit?
Well, I'm really looking forward to this because I've not yet had the pleasure to visit your lovely country. And I've been emailing with a doctor in Kerala. Is that the way you pronounce it? Kerala? Yes, and they're doing some wonderful work with homeoprophylaxis there. So I'm hoping to pop over maybe March, April of next year. And really, because it'll be my first visit, it's really just a matter of introducing myself to the doctors there, hopefully making some good contacts in the local health department, and hopefully being able to gain access to some data. And, they'll be able to see with how I've handled the data from Cuba, the respect that I have for the work that the Cubans have done and the, I think, a very appropriate way which I've been able to help other people around the world get to understand a bit more of the Cuban data. I would love to be able to do that with some people in India. And I mean, if anyone is watching your interview here and would like to contact me with some suggestions or ideas, then hopefully you'll give my details at the end. I would love to hear from people in India, because I know that you are doing some amazing work, not just with homeopathic treatment, but also with homeoprophylaxis. And I have a great deal to learn, I'm sure, from the work that's being done there.
We enjoy the patronage of the government, and we do have a dedicated institution just for research in the field of homeopathy. It's called the Central Council for Research in Homeopathy. I'm sure it would be a great idea for you to go there and visit and maybe connect with more researchers.
Yes, that would be wonderful. So I'm really looking forward. Even if not a lot happens the first time, if a few doors open, then I'll be back a second time and a third time.
Homeopathy, especially with respect to its wider applicability and acceptance in the medical and scientific world.
Well, I think it depends very much which country you're in. So I've been on a couple of speaking tours over the last couple of years, and certainly as you move around the world, there are some countries where homeopathy is being embraced, and India is one, Cuba is one. You look at Malaysia, for example. There are a number of countries, and also in Europe, where homeopathy is quite well accepted. But there are other countries where it's not. I know the English, even though they've got a long history of homeopathy, they've been under sustained attack since 2005, since that fraudulent article came out by Shang in Lancet with the totally inappropriate editorial that accompanied it, which was really, an exercise in non-science. But in Australia, we have our problems as well, partly because we've tended to follow the American health system, which, of course, is hugely influenced by the big pharmaceutical companies. Unfortunately, Australia, despite internet and things like this, we are a bit of an isolated community. We are a long way away from just about everywhere. And the orthodox profession here can basically say whatever they like without there being a lot of pushback, particularly with politicians here. They really rely very heavily on what the orthodox community says. So, unfortunately, we've just recently had the example in Australia where the peak pharmaceutical medicine body, the National Health and Medical Research Council, brought out a draft report on homeopathy. It was quite I've got to be careful what adjectives I use now. It was a very poor piece of science, let me put it that way. The data entry criteria which they used to evaluate homeopathy excluded virtually everything of positive value. So, for example, they excluded anything to do with health. Now, that might seem astonishing, given that they're evaluating a health modality, but that was their first exclusion, anything to do with health. Then they excluded anything to do with the prevention of disease, not just infectious disease, prevention of disease. So all they really looked at in the end was a very, very narrowly defined group of studies, most of which needed to be randomized control studies to pass their bar. However, they even went further because they said in their summary that there were no high-quality studies of homeopathy available. Yet, the research group that they employed to do the legwork, if you like, to collect the data, to collect the studies, to put them together in a cohesive format, the Optum group, actually showed that there were many high-quality studies of homeopathy. So, in other words, the NHMRC They set out to prove homeopathy was not effective in the treatment of certain diseases, and that's what they came up with. Well, there's nothing scientific about that when you go to such lengths to make sure that the data that you're using is heavily biased. So, you know, we've got problems ahead in homeopathy here. The one thing we have in our favour is that a growing number of people are finding out about it and are using it with great positive effect. So politically, that will be our safeguard.
Homeopaths around the world, especially the younger lot.
Sorry, I didn't hear that. I hope my voice is coming through okay. You're starting to break up a bit now. Look, the first thing I'd say is always be true to what we know to be true. So we know that homeopathy works on natural principles, laws of God, and those laws don't change. Homeopathy can be very complicated, and we as humans tend to make it very complicated, but yet it's based on something very, very simple, and we should never lose the essence of that simplicity. The law of similars, the law of minimum dose. The law of similars is much more forgiving than most people realise in terms of practical application. And more importantly, the law of similars is not just about treating people. And when people are taught that in their colleges, they're being taught incorrectly. The law of similars is a much broader thing than just talking about treatment. It certainly embraces prevention of disease, as Hahnemann pointed out, but it also embraces more than that, looking more at a spiritual or esoteric side of it, which we won't at the moment. So what I would say, particularly to young homeopaths, is you've started on a journey where you've learned some really unique and important facts about life, about health and healing, about how our planet works. Remain true to that, even though there's a lot of negativity out there. When you look at the negativity, it's based on ignorance and fear. And certainly, we as practitioners should never base what we do on ignorance and fear. And even though remaining true to what you know to be true is not always the easiest path, certainly in the short term, it's the only path in the long term. So stick with it. That's what I'd say.
Thank you for this wonderful interaction. And I hope that your visit to India is fruitful as it is memorable. Thank you.